Well, we've all heard about this opioid epidemic. It's a multifactorial problem. On the one hand, patients want immediate relief. And the only way to really achieve immediate relief is to take a pill. On the other hand, our providers, our doctors, have been inadequately trained in how to treat pain. My favorite statistic is there was a questionnaire to medical doctors that treat human beings. How many hours did you get in medical school and training on how to treat pain? The average was something like 8.7 hours during their entire training. Veterinarians were given the same questionnaire, and they had, during their training, something like 93 hours worth of training on how to treat pain in animals. One misconception is that if we give pain medication and it relieves pain, then if we give more pain medication, then it's going to relieve more pain. That's oftentimes false. In fact, there is a thing called opioid-induced hyperalgesia. What that means is, in the short term, pain medications can be very effective in relieving pain. But the longer that we use them, and the more that we use them, they actually change the way that the central nervous system functions, and they can hypersensitize a person to the pain that they already have, meaning that the pain medications are actually making the pain worse. And that is the primary issue when we see patients for the first time and they're already on all of these pain medications. We have that problem to deal with first, because until we deal with that part of the problem, we can't even get to the root of the cause, and we can't even effectively treat their pain. These medications can be remarkably effective in managing pain if we make the right diagnosis first. There are certain scenarios, certain diagnoses where opioids are the only option. Sometimes in the elderly, a very small amount of an opioid medication will very effectively manage their chronic pain and allow them to be more functional on a daily basis, particularly in those circumstances when there aren't other options available. So it's not the pain medication itself that is the problem. It's the rationality, the thought process, and the relationship with the patient that has to go into the process in order for utilization of those medications to be effective.